Hello, I'm your host, Neil Howard. Thank you so much for joining us once again here on Health Professional Radio. We'll be speaking with Dr. Thomas Carroll. He's joining us to talk about his presentations from the 2023 American Academy of Head and Neck Surgery Conference. Welcome to Health Professional Radio, Dr. Thomas Carroll. Thank you so much.
Thanks for having me. Glad to be here.
Tell us what it is that you do and where it is that you practice.
Sure. I am at Brigham and Women's Hospital in Boston, Massachusetts. I'm the director of the voice program at the hospital, which means I'm a laryngologist and treat voice disorders, among others. And I'm an associate professor of otolaryngology, head and neck surgery at Harvard Medical School. I was a musician my entire life until medical school and a singer for that. And that's kind of how I got into the field of laryngology, which include breathing problems like cough and swallowing disorders. So it's just been a nice way to combine my two interests in life to take care of people with voice problems.
When you were singing, were you able to offer anyone any advice or solutions on some of their voice problems when you heard it?
Yes, broadly, but usually it's to say, hey, come on in, let me take a look at you. I think I can, figure some stuff out for you, because really, examination is a huge part of what we do, and we have some great technology to allow us to look at the vocal folds in vibration and sort of see how the other muscles of the throat and the larynx compensate for problems.
Was there anything else that pushed you toward this particular specialty?
I definitely liked a surgical option, when I was trying to figure out what I wanted to be when I grew up in medical school. And I like working with my hands, so something surgical, and I enjoy the fact that there's a lot of office-based treatments that we offer. It's not all in the operating room, and there's a good medical component. So as a specialty goes, it's got a lot of the boxes that we check off as we're going through our training, and it just it seems to be the right fit.
What is the hot topic in the field currently?
In laryngology specifically, and again, I'm an otolaryngologist by training and a subspecialty laryngologist. So one of the hot topics is chronic cough, and that's something that I have a personal interest in. And it's a hot topic only because it's really hard to treat. People often, come to our lectures because there aren't a lot of new or great options for treating this problem. So I think, that and just innovations and trying to move things from the operating room into the office in terms of being able to treat a patient without having to use general anesthesia. I think those are some of the hotter topics.
Are there symptoms that could be alleviated simply by a change in lifestyle as opposed to treatment?
Yes, definitely. I mean, depending on the problem, for example, with chronic cough, it can be related to reflux, which we see a lot, liquid coming up from the stomach. Not necessarily always an acidic liquid. It can be something that an acid pill won't fix the problem. So, changing when they eat, what they eat, how soon they lie down after they eat, maybe adding some treatments that are not just sort of traditional acid blockers, but more barrier-forming agents. And then, the other thing is I work with a wonderful group of speech-language pathologists, and they work on the behavioral aspects of a lot of these disorders, including cough and voice disorders, and they're really going to be the ones who, help patients work without medical or surgical, or in coordination with medical and surgical treatments.
We hear singers, we hear talk show hosts, we hear newscasters, we hear voices all day, every day. Are you more inclined to see a person that's a professional using their voice having problems, or are you more likely to see just the everyday person?
It's really a mixed bag. I mean, everybody's a professional voice user in some ways, everybody who has to talk for work and communicate. If you work in a factory and you need to be able to scream over loud machine noise, you can't do that. There might be a safety issue. So we treat everybody, who uses their voice in their work as a professional voice user. It's not just the high-end singer. And a lot of people forget that. If an administrator, say in my division at Brigham, they can't use their voice and be on the phone. That's their job, and it's a tough situation when they lose their voice. So I think we see everybody across the gamut, but a lot of people who just want to be able to interact with their family, spend a day talking at work, and then be able to go out to dinner at a restaurant and talk over loud noise. And those are often the complaints we get. Or one family member can't hear very well, and the other one's not loud enough. These are the real life situations, and we love helping all those people.
Now, this sounds like challenges, around the dinner table. What about some of the challenges that you face in dealing with ENT situations that are far from regular?
Well, I think the most challenging part of any laryngologist's job is often going to be the airway, patient, the patient who can't breathe because their vocal folds either aren't coming apart to allow air to pass or they have a narrowing below their voice box, and which can happen just out of the blue, unfortunately. We don't always know what causes that. And, those patients are challenging because they really, beyond voice and swallowing, you have to breathe first. And you have to be able to breathe and move air through your larynx, your voice box, to actually create a sound between your vocal folds. So, dealing with how do you operate or work on a patient where you can't put a breathing tube in place, or who needs sort of to bypass the normal routes of breathing temporarily. We deal with that all the time, and it is one of the reasons I think a lot of people go into laryngology, because it is a challenging and sometimes scary part of our field. But we love helping the people who finally can breathe without a tube in their neck or without, sounding like they're, stridorous all day and their family's scared they're not going to be breathing. So it's rewarding, but it is the more challenging patient.
Now, it's my understanding that there were some pretty exciting updates in ENT following the 2023 American Academy of Head and Neck Surgery Conference.
The conference is enormous, and it covers so many different subspecialties in otolaryngology. But I presented some information on chronic cough and reflux, and I think it's important, to get the message out there that not everything that sounds like it's going to be a reflux-related disorder is a reflux-related disorder. We have a lot of people who get put on medications for stomach acid, particularly proton pump inhibitor class of medications, that really never needed them in the first place, or the trial they were put on wasn't going to really show much anyway. I have many patients who come to me for hoarseness, and their primary doctor or their community otolaryngologist, ENT doc, has put them on 40 milligrams, a high dose twice a day of a proton pump inhibitor to see if it improves their hoarseness. Really, more so that's the situation where a doctor doesn't have all the tools that, say, a laryngologist might have to look at vocal fold vibration, look at how a speech pathologist see the patient, and really get a real diagnosis. Because often reflux is sort of a diagnosis of default when a doctor looks down at the vocal cords with a white light that doesn't show vibration. Everything looks kind of normal. Maybe it's a little red, and they presume that it's reflux related. So, I meet people who've been on proton pump inhibitors for 20 years because one doctor looked down one day and said, "Oh, you've got reflux, affecting your throat." Mm-hmm. And the reality is, we've learned over the years that you really can't do that effectively. Being able to just look at somebody, is not going to diagnose reflux. So we're getting better about, trying to steer people away from just knee-jerk giving acid blockers and, try to focus on what's the underlying diagnosis. Doesn't mean reflux doesn't cause these problems. It does. But we have more specific tests and trials that don't just treat acid that can help us understand a patient's real underlying problem.
Give us a website where our listeners can learn more.
One that stands out is voicefoundation.org. It's a national foundation that aims to treat all voices, all voice disorders, and it's a fantastic organization.
I appreciate you joining us here on Health Professional Radio and hoping that you'll come back.
Absolutely. Thanks for inviting me.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Thomas Carroll. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.